Welcome to the deep dive. Today we're talking about a simple, powerful tool that you can use to get a handle on your health. The liver blood test.
That's right. And this dive is really for anyone who wants health knowledge they can act on, right away. We're leaning on a great local guide from Blood Test UK.
Yeah, one that focuses specifically on places like Hailsham and East Sussex.
Exactly, to show just how easy this checkup can be.
And our mission today is really simple. We think this test is a fantastic shortcut to understanding if one of your most important organs is doing okay. Finding problems early is the biggest win, and this is your first step.
It really is. And to get why it's so valuable, you have to appreciate the liver itself. It's like your body's main cleanup crew.
Cleanup crew, I like that.
Yeah, it does these huge jobs like detoxification, cleaning everything up, and also making vital things your body needs, like proteins.
So if the liver is so tough, it can regenerate, right? Why do we need to check on it so often? Are people maybe overreacting to small early warnings?
That's a great question, and it's actually why the test is so important. Because the liver is so resilient, by the time you actually feel something is wrong, the problem is often pretty advanced.
Ah, I see.
The whole point of proactive screening, which Blood Test UK talks about a lot, is to catch things like fatty liver disease or hepatitis way before symptoms show up.
So that's the real aha moment. You're looking for signs of stress before the whole system starts to fail.
Exactly. You're looking for the smoke before the fire.
Okay, so what is the test actually looking for in your blood?
It mainly looks at a couple of things. First, enzymes. Things like ALT and AST. You can think of these as stuff that's normally kept locked inside your liver cells.
Okay.
When those cells get hurt or overworked, these enzymes spill out into your blood. So if the levels are high, it's a really simple signal that something's wrong.
And what's the second thing?
The second is bilirubin. That's basically waste material. If the liver is struggling, it can't clear this stuff out properly, so the level goes up. It just confirms the cleanup crew is having a hard time.
Got it. So we know what we're looking for. But for someone listening, maybe in Hailsham or anywhere in East Sussex, the big question is, how do I actually get this test?
And it's surprisingly easy. The guides from Blood Test UK show you've got options. You can go to your GP, of course, but you can also go to private clinics or even some local pharmacies.
Oh, really? Even pharmacies? That makes it much more accessible.
It does. It lowers that barrier so you can just get it done.
What about getting ready for the test? Is there anything special you need to do?
Yes, and this part is pretty important for getting a clear result. You'll probably need to fast, so no food for about 8 to 12 hours before the test.
Okay, that's simple enough.
And, just as important, it's best to avoid alcohol for a couple of days. Alcohol can mess with the numbers and give you a false abnormal result.
Right, and what happens if you do all that, you take the test, and the results from Blood Test UK come back? Not so great. I imagine the first instinct is to panic.
Absolutely not. An abnormal result isn't a reason to panic. It's proof that the test is working. It means you found something early.
You're ahead of the game.
You are.
Yeah.
You now have real information you can take straight to your doctor to talk about what's next. It turns a potential future problem into something you can manage right now.
So this is a simple checkup with really big benefits. It helps you track your health over the long term.
Precisely. That consistent monitoring gives you so much peace of mind. And, it makes you think. If checking your liver every few years is this easy and this powerful, it raises a question for you to consider.
With that,
What other simple, regular checks like for cholesterol or maybe vitamin D could you add to your own health plan to build that complete picture of how your body's doing over time?